5 stretches you should do for kneecap pain.
That doesn't count.
I'm stretching the hamstring.
Yep.
So you can actually use one stretch out strap, which we have, or you can actually do it. Just bring the leg up and pull.
You can do a hamstring stretch
Right.
like this.
But keep good posture. 3 times 30 seconds for the hamstring.
Yep.
And then we're going to do the iliotibial band.
Oh, I see. The figure 4. Sure.
Right. And pull up.
Yep.
Like that.
I like that one myself.
I do too.
It gets the hip really well as well.
You can do the one against the wall. Do you know that one?
Sure. We'll get Sam out of the way. Yeah, the one up against the wall is nice because you don't have to lay down. It's very, just find a wall. I'm going to stretch this one right here.
Right.
So I like to cross my leg over. And
Same with me.
Let this hip drop in. And, you feel a stretch there.
All right, next one, quadricep stretch.
Yeah.
And you can actually get a band, or a stretch out strap and pull on like that.
You can use a belt and put it around your ankle. You could just stand up if you're pretty fit and able and not at risk for fall, and do this.
And then we want to do a calf stretch.
Not getting stretched. Make sure your toe is pointed towards the wall, knee straight, stretch and hold, and then knee bent, stretch and hold, so you get the soleus and the gastrocnemius muscle. And it's nice to hold those for longer periods of time, 15 to 30 seconds.
So the final one is actually going to stretch the kneecap itself. And now you're not going to do this if the ligaments, if you're really loose ligamented or hypermobile.
Some people say double jointed.
Yeah. So you're going to make sure the quadricep is nice and relaxed.
Yep.
Because if it's tight, you're not going to be able to move that kneecap around. But quite often, in people who have patellofemoral pain syndrome, they are tight in one direction of the kneecap, or possibly in all directions.
Sure.
So probably one of the most common directions where it's tight is when you push it this way.
Yep.
And in fact, Brad mentioned in the last video, that's why they often have a surgery where they actually release the tissues on this side so that the kneecap can travel back to where it should be.
I like this round head, because then this is pretty aggressive, but you can just change how aggressive by changing the angle, which is pretty handy. Are we going to talk about if you get by the kneecap?
Sure.
Then, because these come with 5 heads, and this head, it works really good when you come close to a bone and you want to get those tendons where they connect to the bone. It's cushion, it's an air cushion, and boy, these pop on and off extremely easy. Little interference fit there, and we'll get that one going here.
And that's the thing. This thing you can actually pretty much use anywhere because you can go right over the bone. It won't hurt.
Yep.